If you're over 60 and taking any kind of prescription medication, this might be the most important video you watch all year, because new research is uncovering a shocking truth. Some of the most commonly prescribed drugs, the same ones you or your loved ones might be taking every single day, may quietly be damaging your brain, and not just a little. We're talking about significantly raising your risk of rapid memory loss, confusion, even full-blown dementia. The worst part? These medications don't carry bold warnings. Many are sold over the counter, and doctors prescribe them without a second thought. But inside your brain, something dangerous may be unfolding. Today, we're pulling back the curtain on 9 medications that may be slowly, silently harming your cognitive health. If you've ever felt foggy, forgetful, or not quite yourself lately, this list might explain why. Let's dive into what the science actually says and what you can do about it. It's easy to blame aging for memory issues. After all, who hasn't walked into a room and forgotten why? But here's what most people don't realize. Not all memory loss is natural. In fact, a growing body of research is now pointing to a far more controllable cause: medications. A groundbreaking study from Harvard Medical School revealed that certain drugs, especially those that affect brain chemistry, can dramatically increase the risk of dementia in older adults. And the Mayo Clinic warns that the effects can be cumulative, meaning the more medications you take, especially from certain categories, the more your risk skyrockets. Even seemingly harmless over-the-counter options like allergy pills or sleep aids can have powerful effects on your brain over time, yet these medications remain in millions of medicine cabinets across the country, prescribed and taken without a second thought. That's why understanding what's really going on and what the research shows is so important. It's not about fear, it's about awareness. Because when you know what to watch for, you can make smarter choices for your brain. Choices that could preserve your memory, independence, and quality of life for years to come. 9. Antihistamines, e.g., diphenhydramine, Benadryl. Most people reach for antihistamines when they're dealing with allergies, colds, or even trouble sleeping. And why not? They're available over the counter, widely used, and seem harmless enough. But here's where things take a disturbing turn. First-generation antihistamines like diphenhydramine, that's the active ingredient in Benadryl, don't just stop sneezing or itching. They also block a crucial brain chemical called acetylcholine. This chemical is essential for memory, learning, and overall brain function. And when you block it, even temporarily, your brain suffers. According to a study published in JAMA Internal Medicine, older adults who regularly used anticholinergic medications, a category that includes these older antihistamines, had a significantly higher risk of developing dementia. What makes this even more troubling is how easy it is to overlook. You might take Benadryl to help you sleep, or grab a PM pain reliever, many of which contain diphenhydramine. But behind the scenes, these drugs can cross the blood-brain barrier, meaning they reach your brain directly and interfere with the very systems that keep your mind sharp. One large study from the University of Washington tracked over 3,400 seniors for 7 years. The results? Those with the highest cumulative use of anticholinergic drugs had a 54% higher risk of developing dementia. That's not a small number. And these effects didn't reverse when people stopped the medication. In other words, the damage may be long-lasting. It's also worth noting that as we age, our liver and kidneys process drugs more slowly, meaning the effects of these medications linger longer in older bodies. What feels like a safe dose in your 30s could be far more harmful at 70 or 80. If you're using these types of medications, and especially regularly, it's worth a conversation with your doctor. There are often safer, non-sedating antihistamines or lifestyle strategies that can relieve allergy symptoms without compromising your memory. The key is awareness, because what helps your nose today shouldn't cost you your mind tomorrow. 8. Sleep aids, e.g. Zolpidem, Ambien. We all know how vital a good night's sleep is, especially as we age. But when insomnia strikes, many turn to prescription sleep aids like Zolpidem, more commonly known as Ambien. At first glance, it seems like a miracle. You take a pill, fall asleep, and finally get some rest. But here's the darker side that few people are warned about. Drugs like Ambien don't create natural sleep. They sedate. And sedation is not the same as true restorative sleep. What's happening in your brain during natural sleep is a complex, delicate rhythm of electrical activity that clears waste, consolidates memories, and rejuvenates brain cells. Sleep aids, however, blunt this rhythm. They may knock you out, but they suppress REM and deep, slow-wave sleep, the very stages that are critical for memory and brain repair. Over time, this disruption adds up. Studies have shown that long-term use of hypnotic sleep medications is linked to increased risk of cognitive decline and dementia in older adults. In fact, a 2012 study published in the BMJ found that people who took prescription sleeping pills had a significantly higher chance of dying or developing cancer, and the risk was highest in those who took them frequently. Another study from France followed over 8,000 older adults and found that those who used sleep medications for more than 3 years had a 50% higher risk of developing dementia. And yet, these medications are handed out by the millions, often with little warning. Even worse, many seniors continue taking them for years, not realizing they were only intended for short-term use, usually just a few weeks. Add to this the fact that aging brains are more sensitive to these drugs, and you have a recipe for long-term damage. If you're struggling with sleep, it's crucial to look at safer options. Cognitive behavioral therapy for insomnia, CBTI, has been shown to be more effective than drugs in the long run and without the side effects. Melatonin, sleep hygiene, and managing underlying conditions can also play a role. Because sleep is vital, but not at the cost of your mind. 7. Benzodiazepines, e.g., Valium, Ativan, Xanax. If you've ever struggled with anxiety, panic attacks, or trouble sleeping, there's a good chance a doctor has prescribed you a benzodiazepine. These drugs, like Valium, Ativan, and Xanax, are fast-acting, calming, and highly effective in the short term. But when it comes to long-term use, especially in seniors, the risks can far outweigh the benefits, and one of the most serious risks is dementia. Benzodiazepines work by enhancing a neurotransmitter called GABA, which slows down brain activity. That's why they're effective for calming nerves or helping you fall asleep. But this slowing down doesn't stop at your anxiety. It also affects memory formation, attention, and even your ability to learn. The more you use these drugs, and the longer you stay on them, the more your brain adapts by reducing its own natural GABA production. Over time, this can leave the brain dependent on the drug and more vulnerable to damage. A major study published in the British Medical Journal followed more than 1,000 older adults and found that those who used benzodiazepines for 3 months or longer had up to a 51% increased risk of developing Alzheimer's disease. The risk was even higher for those who had taken long-acting versions of the drug. And this wasn't the only study. Dozens of others have shown similar patterns, all pointing to the same conclusion. Long-term benzodiazepine use is linked to cognitive decline. What makes this especially dangerous for seniors is how easily these drugs accumulate in the body. As we age, our ability to metabolize medications slows, so benzodiazepines can linger in the system longer than expected, compounding their sedative effects. Many older adults report increased confusion, grogginess, or memory lapses while on these drugs, symptoms often mistaken for just getting older, when in reality, they may be drug-induced. The good news is, if you're currently taking a benzodiazepine, it's not too late. Tapering off under medical supervision can often lead to improved clarity and reduced risk over time. There are safer alternatives for anxiety and sleep that don't carry the same long-term risks. Because while peace of mind is important, protecting your memory and independence is just as essential. 6. Anticholinergics, e.g., oxybutynin for overactive bladder. Few people suspect their bladder medication could be affecting their brain. Yet drugs like oxybutynin, commonly prescribed for overactive bladder, have one of the strongest documented links to dementia among all prescription drugs. The reason lies in how they work. These medications belong to a class called anticholinergics, which block the action of acetylcholine, a neurotransmitter that's absolutely vital for learning, attention, and memory. In fact, low levels of acetylcholine are a hallmark of Alzheimer's disease. When you take an anticholinergic, you're essentially dialing down the very chemical your brain depends on to stay sharp. That might not seem like a big deal at first, especially if you're just trying to manage a leaky bladder. But studies show the cumulative effect of these drugs over time can be profound. One of the most definitive investigations came from the University of East Anglia and was published in JAMA Internal Medicine. Researchers tracked over 280,000 older adults and found that those taking strong anticholinergic drugs, especially bladder medications, had a significantly higher risk of developing dementia. And the longer they were on these medications, the greater the risk. Oxybutynin was one of the worst offenders. It's effective at calming an overactive bladder, but it also crosses the blood-brain barrier easily, meaning it directly affects the central nervous system. The result? Many patients report fogginess, difficulty concentrating, and memory lapses after starting the medication. Yet they often don't connect these symptoms to the drug. Another concerning detail is how frequently these medications are prescribed to older women who are already at higher risk for Alzheimer's. And once prescribed, they're often taken for years without reconsideration. The problem isn't just one pill, it's the cumulative impact over time. But there are alternatives. Some newer bladder medications don't cross the blood-brain barrier as easily. Lifestyle strategies, pelvic floor therapy, and even simple habit training can also provide real relief without compromising brain health. If you're taking an anticholinergic medication, especially daily, it's worth talking to your doctor about safer options, because protecting your memory shouldn't come at the cost of bladder control. You deserve both. 5. Antidepressants, especially tricyclic types. Depression is more common than many people realize in older adults, and thankfully, it's treatable. But not all treatments are created equal when it comes to your brain's long-term health. Some of the earliest and most widely used antidepressants, known as tricyclic antidepressants, like amitriptyline, nortriptyline, and imipramine, may pose serious risks to memory and cognition, especially when taken over long periods. These drugs were groundbreaking when they first appeared in the 1950s and 60s, but today we know much more about how they affect the aging brain. Tricyclics work in part by blocking acetylcholine, yes, the same vital brain chemical we've discussed in relation to dementia. That means they fall under the same anticholinergic category as bladder medications and antihistamines. And the problem is, they often block acetylcholine much more strongly than other antidepressant classes. A pivotal study published in BMJ followed over 40,000 seniors and found that those who had taken tricyclic antidepressants regularly for more than a year had a significantly higher risk of developing dementia. What's even more troubling is that the risk persisted even after patients had stopped taking the drugs. In other words, the effects weren't just temporary, they appeared to create lasting changes in the brain. What makes this issue especially dangerous is how quietly it unfolds. Many older adults are prescribed tricyclics, not just for depression, but also for chronic pain, migraines, or insomnia. So you may be taking them for a reason completely unrelated to mood and still be exposed to the same cognitive risks. It's also important to recognize that as we age, the brain becomes more sensitive to sedating medications. A dose that seemed fine at 50 can cause fogginess, confusion, or memory slips at 70. This is why the American Geriatric Society includes tricyclic antidepressants on its list of medications potentially inappropriate for older adults. The good news? There are newer antidepressants, like SSRIs, selective serotonin reuptake inhibitors, that have far fewer anticholinergic effects and are much safer for long-term use in seniors. If you're currently taking a tricyclic medication, especially daily, don't stop suddenly, but do talk to your doctor about whether a safer alternative might work just as well without risking your memory in the process. 4. Antipsychotics, e.g., risperidone, quetiapine. When we hear the word antipsychotic, we often think of serious mental illness like schizophrenia or bipolar disorder. But here's something most people don't know. Antipsychotics are frequently prescribed to older adults for completely different reasons, often to manage agitation, anxiety, or even insomnia. In nursing homes, they're sometimes used to calm behaviors associated with dementia. But this well-meaning approach may actually be accelerating the very problem it's meant to treat. Drugs like risperidone and quetiapine, though powerful, alter the balance of key brain chemicals, including dopamine and serotonin, in ways that can impair cognition. For seniors whose brains are already more vulnerable to changes in chemistry, these medications can tip the scales quickly. That's why the FDA issued a black box warning for antipsychotic use in elderly patients with dementia. Not only do these drugs increase the risk of death, but they've also been linked to a faster progression of cognitive decline. A large study published in the journal Neurology found that seniors without dementia who were prescribed antipsychotics had twice the risk of developing dementia compared to those who weren't. That's a 100% increase, a red flag if there ever was one. And the risk rose with higher doses and longer duration of use. What's more troubling is how often these medications are prescribed off-label. That means they're being used for conditions they weren't originally approved to treat, like anxiety or sleep issues in older adults. The intent is often to provide relief or make caregiving easier, but the long-term consequences can be devastating. Sedation, confusion, and memory loss are common side effects, yet they're frequently dismissed as normal aging. In many cases, the behaviors these drugs aim to control can be better managed through non-drug approaches. Gentle routines, personalized care strategies, and behavioral therapies often yield better outcomes without risking brain health. And if medication truly is needed, there are safer, lower-risk options that can be tailored more precisely to each individual. The bottom line? If you or a loved one is taking an antipsychotic, especially without a diagnosis like schizophrenia, it's crucial to ask why and for how long, because these drugs may offer short-term calm at the cost of long-term cognition. And that's a trade-off no one should make without being fully informed. 3. Proton pump inhibitors, e.g. Nexium, Prilosec. Heartburn and acid reflux are common issues for many seniors, and the go-to solution often comes in the form of proton pump inhibitors, or PPIs. Drugs like Nexium, Prilosec, and Prevacid are widely available, some even over the counter, and they're often used daily, sometimes for years. But what most people don't realize is that while these drugs calm the fire in your chest, they may be quietly harming your brain. PPIs work by drastically reducing the amount of stomach acid your body produces. That's helpful for easing reflux, but stomach acid plays more roles than you might think. It's essential for absorbing key nutrients, especially vitamin B12 and magnesium, and without enough of these nutrients, your brain can't function properly. B12, in particular, is critical for maintaining the health of your brain and nervous system. Deficiencies can lead to confusion, depression, even permanent nerve damage if left unchecked. One study published in JAMA Neurology found that regular use of PPIs was associated with a 44% increased risk of dementia in older adults. Another study from Germany tracked over 73,000 seniors and found similar results. Those taking PPIs regularly had a significantly higher risk of developing Alzheimer's disease compared to those who didn't use the drugs. The longer the use, the greater the risk. There's also evidence suggesting that PPIs might directly affect brain chemistry. Some animal studies have shown that PPIs can increase the levels of beta amyloid plaques in the brain, the very same protein clumps found in Alzheimer's patients. While more research is needed to confirm this link in humans, the early data is concerning. And here's the kicker. Many people taking PPIs don't actually need them long-term. These drugs were originally intended for short-term use, about 8 weeks, but millions of people have been on them for years, often without regular reevaluation. Some take them out of habit or because their symptoms return when they try to stop, a known rebound effect that can be managed with a slow taper. If you're using a PPI daily, it's time to talk to your doctor. There are other ways to manage reflux, from diet and lifestyle changes to less aggressive medications that don't block stomach acid as strongly. Because protecting your gut shouldn't come at the cost of your mind. Your brain deserves better. 2. Statins, cholesterol-lowering drugs. For decades, statins have been hailed as life-saving medications. Drugs like Lipitor, Crestor, and Zocor are prescribed to millions of seniors to lower cholesterol and reduce the risk of heart attack and stroke. And in many cases, they work. But what's often overlooked is how cholesterol functions inside the brain and how lowering it too much might have unintended consequences for your memory. Here's what most people don't realize. Your brain is the most cholesterol-rich organ in your body. In fact, around 25% of your body's total cholesterol is found in your brain. Why? Because cholesterol is essential for building and maintaining brain cell membranes, supporting neurotransmitter function, and enabling synaptic connections, the very pathways that allow you to think, learn, and remember. So while lowering cholesterol in the blood may protect the heart, drastically reducing it in the brain can impair cognitive performance. Some research has raised red flags. A 2015 study published in the journal Pharmacotherapy analyzed nearly 500 cases of statin-related memory problems reported to the FDA. Patients described sudden memory loss, confusion, or a feeling of mental fog. In many of these cases, symptoms improved after stopping the statin and returned when the medication was restarted. Another large study from the University of California, San Diego, found that statin users were more likely to report memory complaints and slower cognitive processing, especially when using high doses. The concern here isn't that statins cause permanent dementia in every case, but rather that they may exacerbate underlying cognitive vulnerabilities in some older adults. To make things more complex, not all statins are the same. Some cross the blood-brain barrier more easily than others. Lipophilic statins like simvastatin and atorvastatin are more likely to enter the brain, while hydrophilic types like pravastatin tend to stay in the bloodstream. This means the type of statin matters, and that switching to a different one might reduce side effects. That said, statins absolutely save lives. For people with a history of heart disease or stroke, the benefits can be significant. But for older adults without heart disease, the picture is less clear. A 2020 analysis in the Journal of the American Geriatric Society questioned whether the preventive benefits of statins in seniors outweighed the risks, especially when side effects like fatigue, muscle pain, and memory issues are taken into account. The bottom line? If you're taking a statin and noticing brain fog or forgetfulness, don't ignore it. Bring it up with your doctor. There may be alternative options, lower doses, or different types of statins that protect your heart without compromising your mind. You deserve both. 1. Polypharmacy, the combo effect of 5+ meds daily. This is where it all comes together, and where the real danger often hides. Because while any one medication may have risks, it's the combination of multiple drugs taken together that can quietly erode your memory and thinking ability without you even realizing what's happening. It's called polypharmacy, and it simply means taking 5 or more medications daily. But don't let the name fool you. The consequences can be profound. Today, nearly 40% of adults over age 65 take 5 or more prescription drugs. Many take 10 or more. That doesn't even count over-the-counter pills, supplements, or occasional pain relievers. Each of these medications may seem harmless on its own, but inside your body they interact, sometimes in ways your doctor can't fully predict. And inside your brain, these combinations can create a perfect storm for confusion, forgetfulness, and accelerated cognitive decline. The more medications you take, the more likely you are to experience what's known as a prescribing cascade. That's when one drug causes side effects, like fatigue, brain fog, or dizziness, and then a second drug is prescribed to manage that symptom, then a third, and so on. Before long, you're treating side effects instead of the original problem, and the result is a tangled web of drugs, each affecting the others, and your brain stuck in the middle. Multiple studies have now confirmed that polypharmacy is strongly associated with increased dementia risk. A major paper published in the Journals of Gerontology found that seniors taking more than 5 medications had significantly worse cognitive scores than those taking fewer. Another study in Age and Aging showed that reducing the number of medications, a process called deprescribing, often led to improvements in memory, alertness, and overall quality of life. And here's what's most alarming. Many seniors are prescribed medications by different doctors who don't always coordinate. A heart specialist may not know what the neurologist prescribed. A routine antibiotic might interact with a long-term blood pressure med. Over time, the brain becomes the innocent bystander, confused, over-medicated, and struggling to keep up. But there's hope. More and more geriatric doctors are focusing on medication reviews, sitting down with patients and going through each drug one by one. What's still necessary? What can be replaced with a safer option? What's causing more harm than help? These reviews can be life-changing, because sometimes the key to restoring memory isn't in adding a pill. It's in taking one away. If you're taking multiple medications daily, it's time to ask your doctor for a full review. Not just for your safety, but for your clarity, your independence, and your peace of mind. Your brain will thank you. By now, you've seen how some of the most commonly used medications, ones millions of seniors take every day, can quietly sabotage your brain. Not with obvious side effects, but with slow, subtle changes. A name you can't recall, a task you forget halfway through, a fog that seems to settle over your mind more often than it used to. It's easy to brush these moments off as aging, but in many cases they're not inevitable, they're avoidable. That's the most hopeful part of this entire message, because while dementia is a frightening word, not all cognitive decline is irreversible. Some of it, more than we realize, is drug-induced, and that means it can be reduced, slowed, or even reversed by rethinking what's in your medicine cabinet. It starts with awareness. Knowing which medications interfere with brain chemistry, from antihistamines and sleep aids to antipsychotics and statins, puts you in the driver's seat. No one is saying to stop your medications cold turkey. Many of these drugs serve important purposes, but the key is balance. Are you taking the safest version? Are there alternatives? Could a different dose work just as well with fewer risks? And then there's the silent danger of polypharmacy, when your brain isn't reacting to just one drug, but 5 or 10. That's where a full medication review becomes so valuable. With the right guidance, you may discover that simplifying your prescriptions can sharpen your mind, lift your energy, and even restore parts of yourself you thought were gone for good. This isn't about fear. It's about taking back control, because your memory, your clarity, your independence, they're worth protecting. And it's never too late to start. Comment your age and subscribe for more senior health tips.